Dr. Bermudez, welcome to the Valder Beebe Show live out of Dallas, Texas. Thank you for joining us.
Thank you for having me. Appreciate it.
Well, there's a lot going on, but you and I, we're going to talk about depression treatment. First of all, what is depression, Dr. Bermudez?
Depression is like the common cold of psychiatry, we like to say, because it affects so many of us. In fact, 14 million nationwide are suffering from depression in any given day. There's a lot of subtypes, but generally people feel blue, down. They could feel a little bit foggy in as little of 2 weeks, and they can be diagnosed with clinical depression. So it affects us all. I don't know anybody who hasn't had somebody who's been depressed in their life. So it's a common cold, unfortunately. But the good news is that we have a new treatment that's been FDA cleared that's really effective.
Tell me about this new treatment that's supposed to be better and faster for those who are suffering from depression.
Yeah, the SWIFT protocol is essentially what we call accelerated deep TMS, which is a mouthful. It's intimidating, almost overwhelming. But basically, what the SWIFT protocol is targeted magnetic fields, and you can get treatment in an outpatient clinic. So it's targeted magnetic fields that uses the brain's natural chemistry to heal itself. And we're seeing great results in as little as 6 days of treatment. Now, conventional treatments take a lot longer to work.
Well, depression is different, it seems, in each patient. So how do we make it adaptable to the people who sign on to use it?
Yeah, a great question. So it starts with an individualized, personalized assessment at one of our BrainsWay centers. And, we have psychiatric nurse practitioners as well as psychiatrists who've been trained in this modality. And so it starts there. We we diagnose the individual depression subtype and then design the protocol to meet the patient's needs. And I've seen patients really have phenomenal results in as little as 6 days, but some of them are noticing changes within a couple of days. Some of them say, Dr. B, I can make decisions better. I'm more decisive. I'm less irritable. Music sounds differently. The fog has lifted. These are unbelievable statements. I haven't seen, I've been in practice 25 years doing therapeutic neuromodulation or brain stimulation. These are results that I haven't seen with any other of the other modalities. So I'm really excited and pleased by the results of this study.
I know this would probably take a lot longer conversation, but the SWIFT method compared to the previous traditional treatments that were going on, why is the SWIFT method better?
Well, the results are better and it's faster. So people can come in for 4 hours and get multiple treatments in just a half day, where conventional treatments take 8 to 12 weeks. With conventional treatments like talk therapy and medication, we're seeing remission rates, so no depression, in a third of our patients, And the results of this protocol are just so much better. We're seeing remission, 8 out of 10 patients seeing remission with this protocol. So, you know, double to triple the rates of remission versus the conventional talk therapy as well as medication. So we're really excited. We were blown away by these results.
This is exciting, especially for sufferers of this particular. Let me ask you. I've got a question coming from Instagram. The poster says that I'm going to have to reorient it. The poster says that depression is probably a normal part of life. Why do we have to get treatment for it?
Yeah, all of us could feel blue The other day, my wife said to me, Rich, it seems like you got on up on the wrong side of the bed, so to speak. You're a little bit more grumpy. So all of us can have the blues or the grumpiness, but when it starts to impact our functioning, our relationships over time, we can actually see brain changes on MRI in people who have depression that has been with them for a month or more. So we can actually see parts of the brain start to shrink because of the depression. So I talk about it being like an electrochemical stroke, an electrochemical stroke. And we see this in moderate depression as well as severe depression. So for our own brain health, it's really important to get into treatment.
There you go, poster. There's your response. Doctor, where do we go online and get more information about this? Because they've got more questions than you and I have time.
Yeah, yeah. So you can access this treatment at any of our BrainsWay centers. And this is at brainsway.com. And there's a find a provider button. And you can put in your zip code and find a local center near you. We have over 1,000 centers and clinicians that have been trained in this modality.
Dr. Bermudez, I want to thank you so much for giving us just a little bit of information to start us on maybe finding some answers. Have a great holiday.
You too. Happy holidays.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.